Hi everyone, this is Grace the nurse. Thank you so much for tuning in to the first video of my pharmacology series, and today I'm going to be talking about something that is now on the NCLEX. They are called factor XA inhibitors. You like that? I know, very superhero, but anyway, factor XA inhibitors. What are they? Factor XA, it is a protein, and basically it helps with thrombin formation. So the factor XA inhibitors, they inhibit or hold back factor XA, which prevents thrombin formation to help prevent clots or thrombus. Factor XA inhibitors will now be on the NCLEX, so I'm just going to go over some of the information you need to know, so that when you see it on the NCLEX, you'll be like, I know that because I watch Grace the Nurse. Woo! Okay, maybe you won't do that. I don't want you to get kicked out of the NCLEX testing center, but you can say it in your head. Anyway, so factor XA inhibitors, there are three very common ones. There's apixaban, also known as Eliquis. There is rivaroxaban, also known as Xarelto, and dabigatran, Pradaxa. There is a newer one, apixaban, also known as Savesa. But I'll be honest, in my experience, I've really seen people mostly take either apixaban, rivaroxaban, or dabigatran. So the NCLEX will only test you on the generics, so please make sure that you study the generics. What I like to tell my students is one of the easiest ways to learn pharmacology is at least to know the endings. Now, for factor XA inhibitors, they have various endings, but kind of similar. So apixaban, rivaroxaban, they end in BAN. So you think you're banning factor XA. Although dabigatran, that's TRAN, the only one that's prescribed once a day is rivaroxaban, aka Xarelto, and that is usually taken as one tablet every night. Apixaban and dabigatran are taken twice a day. The advantage of them is that, people don't have to watch their diet. That doesn't mean they can eat fried chicken or whatever. But with warfarin, one of the drawbacks is that people have to be very careful about eating foods with vitamin K. So if people like vegetables, they had to cut back because vegetables would have vitamin K. So with the factor XA inhibitors, greens, other foods do not affect the anticoagulation ability, except grapefruit. So here's an NCLEX tip. Grapefruit is usually contraindicated with pretty much the majority of drugs because it can affect either how well they work or makes them work a little too well. So with factor XA inhibitors, grapefruit juice can actually make it work a little too well and increase the risk of bleeding. But basically every other food is okay. The other advantage is no blood test. So one of the things that people really don't like about warfarin, and I don't blame them, is they have to get very frequent blood tests. Well, with factor XA inhibitors, as long as the person remembers to take their pill and at the same time every day, the level of the medication will stay constant in the body. And as long as they take their pill, they're anticoagulated. So, but one of the drawbacks is if a patient is non-compliant or if they're very forgetful with their doses, if they forget a dose, they are no longer anticoagulated. Whereas with warfarin, if you forget a dose, you still have a little bit of anticoagulation in you. So people who are non-compliant, people who are forgetful, this is not the medication for them. This medication is also good for people who on warfarin cannot keep a constant INR. I remember I would have patients, they would take warfarin, they would do everything correct, avoid the greens, do the blood tests, and their INRs would be all over the place. So people who take warfarin and their INR cannot stay at a constant safe level, the factor XA inhibitors are preferred because, again, as long as the patient takes their medication as prescribed, they're good to go. So the indications for factor XA inhibitors are similar as those for warfarin. So basically, they help prevent thrombus formation with non-valvular atrial fibrillation. What that means is if there's a problem with any of the cardiac valves, they can actually cause atrial fibrillation. But as long as the atrial fibrillation is not caused by cardiac valve issues, factor XA inhibitors are indicated. Additionally, factor XA inhibitors are indicated to prevent DVT, PE, or recurrent DVT, PE formation. Now to go into my NCLEX tips so that if you see these medications on the NCLEX, you'll know how to answer those questions. So patient teaching is very important to know for the NCLEX. In order to encourage patients not to miss a dose, you want to teach patients to take the medications at the same time every day, because if someone has a routine and they know, whoop, hey, it's 9 o'clock, yes, most likely they will remember to take their medication. So the medications, apixaban, dabigatran, those are taken BID, and they have to be taken 12 hours apart. Rivaroxaban is 1 time a day, and it should be in the evening. So I usually tell people, take the medication with dinner, and that way they're good to go. Also, part of patient teaching is you want to teach patients about signs and symptoms of bleeding, because if they start having bleeding, they need to contact the provider, because you don't want that bleeding to get worse since they are on an anticoagulant. So just to review signs and symptoms of bleeding, the most common ones, ecchymosis or bruising, yes, that's a sign of bleeding. Also, if they start seeing little red dots, which is a rash called petechiae, that is a sign of bleeding. Bloody nose or epistaxis, if they have blood in their mouth, bloody gums, if they start coughing up blood, hemoptysis. Also, if they are vomiting and they notice coffee ground emesis, that's a sign of bleeding. If someone has blood in their stool, they may have black tarry stools or frank blood in the stool. And in urine, what you would see is the urine may be, of course, bloody or maybe pink in color. And also, these would be the signs and symptoms that the nurse would need to know in order to notify the provider urgently. So one of the contraindications is bleeding, hemorrhage. So for example, if someone has an intracranial hemorrhage, if someone has a recent GI bleed, factor XA inhibitors are contraindicated because it's an anticoagulant. You don't want them to bleed more. Also, if someone has a clotting disorder, such as hemophilia, that's another reason why anticoagulants are contraindicated. And interestingly, if someone has a lot of falls, a lot of times the cardiologist or whoever prescribed the factor XA inhibitors may actually just discontinue the medication, because yes, someone may have AFib or recurrent PE, but if they're constantly falling and maybe hitting their head or whatever, their risk of bleeding is increased. So unfortunately, if someone is a frequent fall risk or has been falling a lot of times the factor XA inhibitors will be discontinued. Another contraindication, grapefruit. So grapefruit, as I mentioned, is contraindicated with the majority of medications. So you want to teach patients not to eat grapefruit or drink grapefruit juice, because it can actually make the medication work a little too well and increase their risk of bleeding. Well, that was my Grace the Nurse review of factor XA inhibitors. You like this? Very, very Prince. Anyway, I hope you enjoyed this video. Please check back soon for another video in my pharmacology series. Well, I really appreciate all the support. Thank you very much, and I will see you next time. Bye.